Hey everyone. I got so busy yesterday that I wasn't able to put a journal entry in, but the question I got yesterday um, is what was my experience with hospice care? And it's funny, Lee and I recorded a video earlier, and anyway, we got the instructions mixed up, so we needed to do it separate. So after this, I'm going to be posting another video with Lee, my husband, and one of him and his brother were my primary caregivers. So him and his brother addressed the question as well because, well, they want to hear it from all sides. So we're doing that. So I graduated into hospice care from home health care. I got sick in it was 2019, and I was super busy and stressed, and I was throwing up a lot of blood. And anyway, I was doing a charity softball event, and I just assumed that I had ulcers, some bleeding ulcers or whatever, because there was just a lot of blood when I was throwing up. So I was going through this event that I wanted to get through, so I didn't say anything to anybody, and then I didn't say anything to anybody after that as well. My niece happened to, I called my niece in finally because I was I was throwing up a lot of blood, and she was staying with us at the time, and she was the first one that knew anything was wrong. But I'm saying that to kind of give you a timeline, because I was sick through COVID, through the pandemic. So so I went into the doctor's office. I was first diagnosed with multiple myeloma, and then which is blood cancer, and then I was diagnosed with cirrhosis of the liver, and I was in stage 4 cirrhosis of the liver, NASH, which is actually non-alcoholic cirrhosis. Although the alcohol that I did drink didn't help at all. So I'm going to put that out there. But I just kind of wanted to put that timeline out there and kind of give you an idea of the time. But I ended up through going back and forth to the doctor, and when COVID hit, then we were doing home health care, which was a disaster in itself with nurses. And if nothing else, the world needs more nurses, competent nurses, nurses with compassion. We need to be screening our nurses for mental health issues. There's a lot of nurses out there with mental health issues, and I know that from experience. And it's a very scary feeling. Also, we just need more competent nurses, and nurses that have compassion. I did run into a couple great nurses, and Jenny, I love you so much. You are the squishiest nurse. I just love you to death. I just love her. Anyway, so I went from home health care to palliative care, and then to hospice care when my body started shutting down. Everything started shutting down. So I wore a Foley catheter for close to a year. Obviously not the same one. They were switching it out every so often. And I wore the whole bag on my leg. And then they switched me to self-cath. So I had to learn to self-cath, and then I had to cath every time I went to the bathroom. Um, my body was shutting down. My bladder was shutting down. I was the smallest I had ever been in my life, in my adult life, and pretty yellow and pretty sick. So I was very, very adamant about not taking a lot of opioids and not taking any in the beginning. I really relied on medical marijuana to help the pain. Rick Simpson oil prolonged my life. I know that it did. If you don't know what Rick Simpson oil is, I encourage you to look it up. It is a game changer. And Lee would put it in capsules for me, and I would take that for pain. And a lot of my numbers improved. My diabetes at that time was all but cured after I got on the RSO. So I got off the RSO, and now it's back. We'll discuss that later. Anyway, so the experience was, it was terrifying. You know, when you hear those words, it's terrifying. It's life altering. I mean, hospice care, I didn't feel at that time I was dying. I mean, I knew that I had a disease, and I knew that I felt like I was dying. But when they put me in hospice care and, you know, explained to me that, look, the doctor said 2 weeks. He said before I wouldn't make it through the holidays. I did make it through that set of holidays, and I was well on my way to the next set of holidays, but he assured me that I would not see holidays 2021. So he made that super clear, and we were in maybe early October of 2021 at that time. And subsequently, I was registered at Ohio State University on the National Registry, and at Ohio State University, my insurance would not allow me to be multiple listed, so I could not be listed at other hospitals. I was not aware of the transplant program at University of Cincinnati at that time, and I know that that's topic is going to be in a video because I saw it on the sheet. It's there, so we're going to get to that. But so I had a port in my chest that we would run IVs through and such, shots and things. And I was in dialysis for a while, and I had a port for that. And they took those away at one point in time because when I was put in hospice care, I just needed to have I wasn't in dialysis anymore. They wanted to put a PICC line in me for one reason or another, and I couldn't remember. But and you got to remember, I had hepatic encephalopathy, so it's a lot of it's fuzzy up here. So that's why we've got my caregivers kind of filling in the gaps. And so I ended up with a PICC line in my arm, right around in this area, and that went into, well, we know that goes up. So they came in. I had to go to the hospital to have it surgically put in there. I went home, and the next day, the nurse was supposed to show up to show us how to do it, and she didn't. A week later, maybe 5 days later, but the nurse came in finally, and she showed us how to put the medicine in, hook the fluids up, hook the bag up, hook the line in, into into the thing, how to clean it, how to flush it with a heparin, um, all that, how to handle it, how to make sure this is this way and this is that way. And I mean, even so much as how to, adjust the flow of the IV, because there were times when I would sleep for, I most of the time I'm asleep because I'm on medication, but um, sometimes it would be a 3-hour bag. It'd be a 3-hour deal or 3.5-hour deal, and at one point in time I was still fairly active, and I could unhook, obviously, and go do whatever. And I did. I went to some concerts. I did all kinds of things with the PICC line in. I just had to keep it super clean and make sure that I was only, getting fluids or whatever. I would take it to the hotel if we spent overnight, and that's a whole other story. But try not to get off track because I tend to do that. So when they put me in hospice care and told me that, my time was super limited, this is in end of September, early October. It was early October. And so I had to, it had been a long time, so I had to start getting my testing again. So I had to go get another mammogram because it had been a year since I had a mammogram. And I got a mammogram, and it came back that there was a lump in my right breast. So they had to do a biopsy on it. So with my body falling apart like it was, and nothing was really working correctly, and all the ammonia was sort of going to my brain, I had to take a test where I had to eat nuclear eggs, and it showed them on a scan how long it was taking my food to digest, and it just wasn't, it would stay in there for a very long time. And so in learning those IVs and things, then they learn how to give me my medications and my fluids and things. It was hard emotionally because I knew what hospice care meant, and I knew that I was going to lose my life to that disease, and I was devastated of all the people that I was leaving behind, my son, my kids, my grandkids. I literally have the most amazing husband on the planet, and I was really, really, really just not wanting to die. And when you're little and you're growing up, if you ever think about passing away, you always envision your family around you, and everybody's loving on each other, and even holding your hand, and so many things. And I didn't have my biological family support. My siblings, no calls, no shows up, no nothing. My mother was coming around, and the further along I got in progression of my disease, the more that kind of backed away. And I kind of knew that because, it's scary. It's got to be scary to watch your kid die. But so I began to meditate and ask for my life to just be taken while I went to sleep, and then I would wake up and be angry because I was still there, and realize that I was still in so much pain, and there wasn't anything else that could be done for me. I mean, except to get me a liver. And I had been on the list so long at this point, I really didn't think it was going to happen. And I remember specifically going to sleep and thinking to myself, this could be it, because I had went to the doctor that morning, and he had said, this was on a Monday, I believe, Monday or Tuesday. I don't know. I'll have to look that up, because I'll have to back it up with paperwork and facts. And, but I remember that particular morning, I was feeling okay. I mean, I was talking, but my breathing was starting to get labored, and um, you know, my heart rate was just slowly, day by day, getting slower and slower. But the phone rang, and it was Ohio State University, and they asked me to come up and get a liver. So we drove up there, and ultimately, when we got up there, we were turned away because possible cancer in my breast. The biopsy results weren't back yet. The next day, the biopsy results were back, no cancer. They put a tumor marker in, and they were done. Um, and that kind of brings me to that week when I went to the doctor, and he said, on a Monday or Tuesday, he said, yeah, before the weekend, it's looking like, you know, I don't think you'll make it through the weekend, and that's hard to hear. But I was feeling it. I felt myself shutting down. I mean, I couldn't even think clearly. I did a lot of crying. I did a lot of yelling. I was angry. I was so sad. I was so sad. Like, why didn't the people that I love so much bother to even call me? Or nobody's coming to say goodbye? I mean, we were raised together. Nobody, I'm not gonna get emotional, but it was heart-wrenching. And then I look around me at these two grown men who just swooped in to take care of me, and my 14-year-old son and my stepson, and my oldest daughter was occasionally around. I have an amazing brother, and he's not even a real brother, in West Virginia, and his buddies. And I realized that I did have a support system. It just wasn't the one that, when I was dying, that I saw around me, you know. I really thought that I would see all of my kids, my siblings, and that wasn't the case. So it was heart-wrenching. It was sad. And I was scared. I can't even lie and say that I wasn't scared, that I was strong and I was a fighter. No, I was scared. Every single night was a different dream about how I was going to go, where I was going to go. Was I going to be on the couch? Was I going to be in the chair? Was my son going to be home? So many things. And bringing that to, I would always joke with my hospice chaplain, and he would, you know, he was very serious and, you know, trying to get me to face mortality. And I just surrendered at one point, and realized that this was it. And talking to him, me and my mother had fallen out over her boyfriend. Doesn't matter, but we had fallen out, and I hadn't talked to my mother in a couple of months. And, you know, he had told me, if nothing else, to hell with everybody else, I at least need to be okay, where my mother was concerned. So I called her up on Wednesday, and I said, hey, we really need to talk. Doctor's saying it could be the weekend, and I really have some things I need to say. So she picked up my oldest daughter, and she came over, and we sat and hashed it out. And we talked, and we cried, and we talked, and we yelled, and we yelled, and we talked, and we cried. And it released in me. And you know, I had to take my vitals. I was taking my blood pressure. I had to take my oxygen. Had to take my temp. I was doing a vitals check, and you know, my My heart rate was steady, just going down. My pulse was steady going down daily. And I knew that it was getting close because I had to work to breathe. And it hurt sometimes because I had to go deep to find that breath. And I'm sitting talking to my mom, and the phone rang. And it was the doctor, and he just, I don't want to go too far because I know that that's going to be a whole other video about how that call and everything went down. But that call came in while my mother and my oldest daughter was there. Ironically, Lee and Mo had went to the store, so they weren't there when the call came in, but as soon as they walked in, we let them know. And here I sat. So hospice care was, it was terrifying. It was scary. It was sad. It felt dark. You know, they want you to be comfortable when you go. And at that point in time, I was getting pumped morphine. And yeah, I wasn't in any pain. But I wasn't in any pain physically. But I was in a lot of pain emotionally and mentally. And I graduated hospice care. And I always told them that I wanted a damn balloon. If I graduate hospice care, I'm getting a balloon. I still haven't got a balloon. I'm going to get one though. But thanks for listening. I went over a little bit. They're trying to get me to keep them at 15 to 20 minutes, so I'm going to stop. And I'll be back tomorrow.